It's like, So this is a young dog that came in for lethargy and just seeming off with kind of a decreased appetite. She has a longer history of having copper storage hepatopathy, which is basically a disease that her breed of dog is predisposed to, where there is a mutation and copper accumulates in the liver inappropriately. She's been on medication for that for years, so I felt like we did a bunch of other non-invasive tests, and the next right step seemed like an upper GI endoscopy for her. Lo and behold, we found multifocal areas of ulcers in the stomach that we can start treating her for now. We have some biopsies as well. And since she was doing so well under anesthesia, I was curious to see, since she's been treated for so long for her copper storage disease, is that much better? So we got some minimally invasive liver biopsies as well to check her copper levels and see if there's anything that we can do to be helping her more, or if we can get her on lower doses of some of her medications. And she did great under anesthesia, and she's going to go home in about an hour.
I'm Rachel Sirois. I'm one of the doctors with the Internal Medicine Service, and we wanted to share sort of an interesting dual service case with you today. So we have Mia, who is a hound mixed dog who presented for very acute onset drooling and just not acting like her normal self at home. She historically has been pretty healthy, but the night prior she did have a history of unfortunately getting into some meatball subs, whereby she did ingest some cocktail toothpicks of about 4.5 inches in length. The owners had the other half of the second toothpick, but about 1.5 toothpicks were missing. When she came into the hospital, we took some x-rays of her neck area and her stomach, and we could see some pretty severe swelling at the base of her tongue, as well as a piece of the toothpick in her stomach. So we initially sort of went ahead and did a CT scan to get a better look of sort of the swelling in her neck. And then following the CT scan, we popped down into her stomach with a camera and a little sort of grasping instrument in order to pull out the first toothpick, which was present in its entirety. So we knew we had sort of the whole thing there. But then the question was still sort of what was going on with the swelling. It didn't really make sense that it was just from trauma from that toothpick passing. And so we did do a CT scan, and what you can see on the CT scan is that unfortunately this sort of bright linear foreign object here is likely the sort of second toothpick, and you can see it sort of going almost the entire length of her tongue here, and it creates sort of this little abscess here as well. And so when we sort of got these images in the final report back, we knew that we were going to have to involve the surgery service to kind of go in there and really explore the area and try to remove as much of that toothpick as possible. And so we teamed up between the medicine and the surgery service to be able to get in and go get it.
Hi, I'm Jeffrey Runge. I'm one of the minimally invasive surgeons here at Guardian Veterinary Specialists. I want to tell you a little bit about Mia, a case that Dr. Sirois just kind of summarized for you. Basically, Mia had a foreign object that was impaled in her mouth, which lodged itself into the tongue very deep, almost as if you had a gigantic splinter deep into your tissues in your foot. This area was beginning to get very inflamed inside of Mia's mouth. And as a matter of fact, it caused so much swelling that it actually created a situation where Mia had a difficult time swallowing and was very uncomfortable. What our plan was after seeing the images on the CAT scan, we knew we had a special little region that we can go into the tongue and begin to extract this out. However, it was bedded so deep that we knew it was surrounded by an abscess, and my idea was to try to get this minimally invasively out of Mia's tongue. What my team and I were able to do was locate this on the CAT scan and use Dr. Sirois' ultrasound to tell us the exact location of this. We then made a very tiny incision and placed a scope into the incision near where this little skewer foreign object was. And I was able to find it with a camera and then use another instrument to grab it and pull it out with the aid and guidance of the scope. So this allowed us to actually do a very big surgery through a very small incision. And ideally, that's one of the big advantages of minimally invasive surgery, is doing big surgery with very tiny instruments with great magnification. So this was excellent. So right now, Mia is recovering very nicely. The foreign object has been extracted, and ideally will go on to an excellent recovery and healing.